1.5 million viewers right now tuning in with our streamline, and they also give us their questions through telephones, through text message, and also the other online methods to already submit their questions. And before they submitted the question, they will first fill in the forms. This year, we have a lot of questions received from the app. So you can see this is the app, and they ask questions online. So through this app, you can not only submit the word question, I also can take a video to ask your question. So you can see this is a very easy way to record yourself and ask questions. So, which means your focus, your attention, your questions will all received. You not only submit the questions, and you also can showcase yourself, and also if you'd like to ask questions regarding transportation, you also can take a video right on site. So today, with our special program, we're still continuing receiving your questions. So all your questions will be broadcast live. Each and every question you ask, we have a special person to give you the feedback. And after the live program, we will continue to answer your questions. Now, it is the show time. So, as we know, before you start our live program, you already well prepared. I believe you already have some of your focus and also made preparation regarding questions. Yes, I knew which areas, which fronts I should have prepared, because in my work, we should know exactly what is the most concerned our people, what is most interested our people. Very obviously, the most important sectors and also that need urgent focus, actually there's no secret. It's the people's livelihood, their income, health. All these. And also the waste management. I believe this is urgent questions with people's keen concerns. From my understanding, actually, we should have some national program to solve these issues, but our citizens not really know exactly what can be included under the umbrella of national programs. What I like to say is, first, I really appreciate the people who ask questions, because this is also top of our priority. What we want to achieve is want to deliver the maximum benefit to our people. We would like to develop our economy. So within the framework of national program, we will carry out these endeavors to bring the benefit to our people. And we would also like to utilize the advanced technology to safeguard our people's life. That is, make us to make some guidelines and also categorize our work. Of course, that all should be done step by step. That's a lot of work to do. First, we need to understand which way we should go to achieve the target. And all these actually should be financialized by the federation government. So first, we should really improve our capability of providing service to our people. So we should have our financial support from the government to improve our infrastructure construction and to deliver better service to our people. We should have a better quality of bridge, transportation, telecommunication networks, and also for power supplies. I also can mention other fronts. But for our next step, we should make the right decision to promote industrial development. I can give you some good examples with great outcomes, but what I would like to say is we should really focus on the outcomes of each program. We should be result-oriented. So let's say within half hour and within half a year or 1 year, we should see how the government controls inflation. We should focus on the industrial growth. The growth already happened. The number I said yesterday actually already showcased that the momentum is upward and also people's income is improved. All expected result and the planned results right now is all happened. So talk about improve people's wages. That's also quite important. We have questions received from different areas of the country, and I would like to hear your answers. Talk about the average wage of 10,000 rubles. Actually, it's really hard to support one family. This is a question received from the border area. So let's look at the details. Actually, we received a bunch of questions. So talk about the food security, talk about the children's education. These are all the questions asked by our people. So talking about education. So teachers' income actually is underpaid. Under this circumstance, it's really hard to guarantee the quality of education. So, Mr. President, I'm a firefighter. So the wages is around 12K to 40. It's 120K to 140K, and we actually every shift is 2 to 3 persons. And the whole condition for our country, actually, we really work really hard and we face quite big challenges. We need to really put out the fires in different areas. This is the real number, right? Yes. So we will verify the facts because we need to make decisions based on these facts. We already set the bottom line of the minimum wages. But talk about how to guarantee people's livelihood. Of course, this limited income cannot really provide a good life. I don't know why we have this number. We also have received questions from other areas of the country, and their minimum wages actually is lowering. So, of course, we should decide case by case. We should look into the different scenarios, but talk about like this emergency department. Some people, their salary is around 40,000 rubles. I also talked to the Minister of Emergency, and also the relevant ministries. So we will grant 300,000 to 400,000 rubles as emergency funds. All what we want to achieve is we want to improve people's income on the average to 250, 240K. Of course, the ultimate goal is to reach number of 350,000. This is our goal. That's 350,000 rubles. Right now, we receive more questions. This is a question received from a retiree in Moscow. This is a video phone call. So let's get back to the salary issues because this is a really hot debated issue. So people saying that their salaries actually is decreased. Some people call themselves middle income class, but still a majority of people call them people under poverty line. So what they keep complaining is they're facing a quite difficult scenario. Yes, indeed, that's also top of my agenda. Decade ago, we already suffered some changes in our economy. And right now, we're also facing the sanctions imposed by the Western world. This is impact our exports and also the price of oil and the gas. Of course, the import and export of chemical products and metals. So overall, the current scenario is not optimistic. That also is not a good scenario for our economic and social development. In 2016, our economy hit the bottom. Right now, it's come to the recovery stage. We should clarify two different concepts. One is the real income. Another is people's salary. The real income is not downward. We need to think about their real income. So basically, it's their salary and their expenses. Right now, people getting loans. And the loan provided by the bank is also under a new round of amendment in terms of policy. So we need to really look into banks' policy and terms of all these loans. Of course, this is a big risk for our people. Look at our market. Our market shrinked, which in turn impact people's income. Of course, there are other factors. So talk about salary. That involve two parts. One is the number in book. Another is their real income. So number increased by 40 to 42%. I can tell you the exact number is 54%. The number I'm talking about is the average level. Why I talk about this average number? So because the gap of income is huge. It depends on different area, different regions. Talk about Moscow. So this is with a big gap. And also, the gap also exists in different factors. Talk about the people in the financial sectors and people in agricultural sectors. You can tell they have big income differences. Actually, I can talk about this for 3 to 5 hours. So average number is frequently used. What we would like to see is a trend that reflected from these numbers. Right now, the average income is 45,000 rubles. The growth rate for last year was 8.5%. The updated number in May is 8.2%. All relevant government offices right now redouble their effort to improve this number. It's fair to say that, of course, we have some tasks to perform, but we will hit the target. This is the second point I would like to make. And the third point is that we would like to improve the minimum wage. It involves a large number of people in Russia. The rough number is 43,000 personnel, and we will also improve the payment to the servicemen and women. Talk about dissension. The pension will also in our focus because we want our retirees have enough money to support their retire life. Considering the factor of inflation, the pension took up 7.05% of GDP. Start from October this year, we will improve the wages paid to the armed force personnel, as I just mentioned. All in all, we focus our attention on how to improve people's salaries. Talk about the national programs. Indeed, let's also channel our effort. Because the main measures is we would like to implement national program to improve our economies, to increase people's salaries in different industries, and also make our people live in a better life. So we should really work in a coordinated way to boost our economy, and all other factors will come along. Some group of people, they would like to talk about the achievements already made. And let's talk about our second question about our healthcare service, because people saying that we receive poor quality of healthcare. So let's look at the questions. My name is Anton from Smolensk. And my name is Dimitri. Thank you for giving us this opportunity to ask questions. Right now I'm in the city center with a population of 50,000. Right now I'm in front of a clinic. So there is a mom with me for the interview. You can see the small baby here. So the baby's name is Maximum. So the mom has an issue right now she's facing. So the thing is, we will receive some papers from the doctors, but we need to wait 2 to 3 months. So sometimes we already receive the prescriptions from the doctors. We still need to wait for 2 to 3 hours in the hospital or the clinic. We cannot receive a higher level of doctors in terms of capabilities. So we have really narrow choices. Right now we're at the Smolensk. If we want to see doctors in other areas, that's actually spend 2 to 3 hours. For a baby, actually, this is a long journey for them. So let's look at this clinic. And I also would like to hear the comments from the doctors. So you can see here, today is Thursday. So we not have a really long queue here, but let's look at this is the registration reception desk. So right now in the program, direct line with the president, I would like to say, so what's really the issues for people to receiving the treatment? My name is Melina. So when people come here, we help them to register, and we also receive phone calls for people to make appointment. So if we want to make an appointment with surgeon, so which date we should make the appointment? This is a name list of surgeons available today. So today is Thursday, right? Basically means these doctors are available to give treatment. What about doctors from different departments? So I think overall, there's no big issues in your day-to-day life. So talk about the work. Of course, there are some difficulties, minor difficulties, but of course, we will not really to say I give you the treatment to this patient, not give to that patient. We treat patients equally. So let's say this is one of doctor's office. So hello, we are right now have a live program with President Putin. So people seeing here, like we have the field doctors available to give the treatment. So what exactly is the situation going on? How many doctors do you have here? Yes, we have some difficulties in this regard. This year we will recruit 2 to 3 new doctors. Yes, we're short of hands. But talk about the exact numbers. I cannot provide you the exact numbers. So what's the wage? So maximum number and the minimum number. The number varies based on where you are. So you need to really refer your question to the related governmental department. The average salary is 20,000 to 25,000 rubles. So the experienced doctors, their salary is around 60,000 rubles. This is a huge gap. Yes, I would like to say to the federal department, Right now, we need to recruit new doctors. They should come or they graduate from the medical schools. So these facilities is renewed in 2016. This is a new medical center. And the facilities actually also advanced. The overall cost is around 500,000 rubles. So we see people waiting here. So they need to really make their trip here 5 a.m. in the morning in order to get a chance to make appointment. Do you think we counter a problem? No problem. But we still see there are many people waiting here. So let's see that here is after all this renovation and we have new equipment available here. But let's have an interview with the people queuing here. So do we need to really wait a long time here to book appointment with the doctor? No. Or yes. Yes, we should wait for a long time. I already waited here. I just waited for 3 weeks to get available ward. Right now we're having a direct line with the president. Actually, we don't have doctors, or we have a lot of experts. They already left the hospital. Of course, the reason behind is the lower underpaid. The governor of this border area already said that he welcomes the doctors or the people with high capabilities who work here. So people, actually, the small number of people, they can receive treatment in Moscow or St. Petersburg, but still the majority people, they know other ways to solve this issue. Right now, we're in a village. So this is a new facility. In this small village, it's really rare to see this advanced equipment. So this is help people for rehabilitation purpose. But still, the practitioners underpaid. We only have 2 specialized personnel are working here. So for villagers, this is a huge issue to them. For the elderly people, there will be an even bigger issue for them because they only can see the professional doctors once per month. This is a really urgent question. You look at this office, we have outdated equipment. Talk about young practitioners, they don't have that willingness to work in the village. So would you like to share with us that for young generations, we lack of new hands, right? Yes. I believe the main issue behind We don't have really good living conditions. The experts come here and actually they feel it's not really satisfied. They don't really like the living conditions, and they not agree to stay. For local people, we have to work here. So basically only 3 people working here, right? Really hard job, right? Yes. Especially when we have a long queue waiting outside. Thank you. So the issue is quite prominent. For a lot of medical institutes, the short of hands is right now the biggest issue. For villagers, I believe this is something need to solve urgently. So talk about with lack of people, with lack of doctors. So I would like to say, talk about the doctors, nurses. We know we have many problems here. This is directly related to people's day-to-day life. There are many issues. Fundamentally, we need to say which should be our top priorities. Number 1, we talk about availability of the doctors and the nurses. And number 2, we should have the high capability of doctors. And also right now we lack of these group of people. And number 3, we talk about how we can make sure people have the guaranteed prescriptions to use. Of course, we have more than that, but right now on my list, they are the 3 top issues. In some regions, from our observation, we see the number of personnel is decreasing. In certain departments, we look at 18 regions. And we also observe the scenario that the service quality is also decreasing. In some rich area, so the practitioners with rich experience. But still, we talk about the people working at the front line. We witness a decreasing number. So I also would like to refer these questions to the Minister of Health to find out the solutions. And we, of course, will fully support the medical institutions. Right now, what we will do is we will open 400 new institutions, especially to the areas with a high density of population and or the remote areas. We will have 800 construction groups to help us to build up these facilities, and we'll also buy new equipment. We will organize the group of experts to make sure the people have the access to the medical service. Of course, we will give a fair pay to this group of people. The number is around 500,000 rubles. and talk about the living standards, living conditions. We will grant millions of rubles to solve this issue. Of course, they will from the central government budget. Talk about the personnel. We lack of personnel. And first, we should improve their payment. I just heard the number of their salaries quite underpaid, but the overall number actually increased by 5%. In Moscow, in St. Petersburg, the salaries are quite good, but we should really find a way to narrow the gap of the payment differences. Right now, we look at a growth rate of 0.3% to 0.5%. We should strengthen our effort to make this number larger. So for the young practitioners, right now, their average salary is around 35,000. And talk about medicine. We also receive a lot of questions receiving medicine. And especially the price of the medicines, such as diabetes. And people want their voice heard by the president. First, we should make all these medicines available to our people. This is from the federal level and also the regional level. For the federal level, start from February, we already allocate the fund to the federal entities, talk about diabetes and other diseases. We had a new calculation so the federal entity actually can decide by themselves how much they would like to buy for different prescriptions. So what is exactly the situation? We have an inventory of these medicines, but these inventory in the end will not really received by our people. We should focus on how we can improve our information system. We should use the modern way to let our people know the information of medicine. We should improve the service quality. And also have more people working in the health industry. So we should guarantee that the people, they do not need to travel to other places to get a medical service. They can get all the medicines where they are. But the thing is, in some regions, the procurement of all these medicines, especially the medicines really related to people's life, are not enough. We should first identify which are the key medicines you have to buy enough numbers. We should create more opportunities for people to work in the industry. Thank you. Good afternoon. We we work really hard to develop our infrastructure. We have already seen a big improvement of infrastructure in my area. Every year, we establish 200 to 400 centers. Eighteen out of 85 regions, their medical institutions or facilitations actually is in poor condition. We talk to the people in charge in different regions. For the western regions, we already see more practitioners coming to the field. So what about medicine? What are the achievements made in your area, western region? As President Putin mentioned, for key medicine, we already gave 5 million rubles. This is the number before February this year. In different regions right now, we are working hard to give more grants to the regions. And some regions under the food reform and correct their way of purchasing medicines. And in some other regions, they also use the really outdated information channels, and that also the undergoing endeavor. Sorry, I have to interrupt you because right now we're receiving so many questions. Sorry to stop you, but I heard some information. You talk about funds or the grants. I know the number increased. Yes, the number actually doubled. So the capital to purchase new medical facilities are doubled. So this is, of course, happened under the framework of national program. So you can see right now our people working so hard and very busy because we receive the many phone calls, FaceTime, and online questions. There are a lot of questions asking a national program. What kind of the task need to be completed through the national programs and what we need to do? And that is also our next question. Please introduce yourself. Good afternoon. My name is Valentina from Moscow. Dear Mr. President, my question is regarding national program. You mentioned this word already. I would like to know exactly what achievement we already made and how and what expectations we can have for the future work. We have already seen some early achievements. I know this is with great significance. Right now, we actually integrate our resources, capitals, and personnel to heed the call from our people and solve their keen concerned issues. We need to achieve a breakthrough. We need to make a breakthrough. We need to find the way, the direction of future development. I'm talking about here is how to improve people's livelihood. This is the key direction of our national program. I would like to reiterate what we need to do is we need to transform our economic structure. We need to develop a digital economy. We need to focus more on the automation. We need to develop the high-tech industry. All these will help us to see a new development in our economy. So we talk about road construction and reconstruction that may need 600 million rubles. And we also calculate the number for medical industry. We talk about the number we need to have for the science and technology front. And we also, based on our different priorities, we have the different number of personnel we need for different targets. And we also evaluate our results based on the different priorities. So by year 2024, we will see what we can achieve. Of course, that should be different outcomes based on different industries. I know people in different sectors working really hard. We talk about people right now. It's not the people in the Soviet Union era. We talk about people right now in the current time. What really the people right now focus? They focus on the salaries. They talk about their personal or the career development. And we also talk about the medical care. This is also something with their keen concern. That is also the areas we need to give more national budget. So talk about our first step. Of course, we see some negative impact because we would first mobilize and centralize the resources available to achieve our goals and to make breakthroughs in our economy, and we also will see an explosive growth happen in our economy. Recently, you also had a series of meetings with ministers regarding national programs. You also actually gave their KPIs to the different ministers. Yes. We would like them to achieve the requirements to fulfill the obligations. Also have some media friends already that also participate in our meetings. We shoulder their respective responsibilities. Talk about our wage treatment. That's also our next question. So I would like to have a map showing here in this big screen. Let's see the questions we right now received. So we received a question from Rostov. We see the picture. So you can see this is a picture we got. This is just right in the street. So this is also the scenario here, the landfill of wages. Actually, we have the questions asked last year. So let's see a blogger with 18,000 followers. Her videos are actually quite popular online. So let's hear from you, Mr. President. I'm a blogger. Represents the teenagers. My question is that there are a lot of debate regarding the wages in Moscow, in Russia. So for the people right now in middle schools, what we heard is that people really would throw their wages as they wish. I also discussed this question yesterday with my colleagues. I heard the feedback from my colleagues yesterday. I also knew that the question asked last year, and people in charge in different regions already start to tackle these issues. I understand in different regions, actually, there's no solid progress made in this area. And I also would like to share with you one number, is that if you compare 10 years ago, or even compare to the time in Soviet Union area, actually the number of wastes increased dramatically. Talk about the packagings, paper packagings. That is a way for us to have less plastic wastes. And right now we also learn from some European countries for their best practice. Just now you just mentioned this issue in one region, but I believe this is something shared in different regions in Russia. Yesterday we also talked about that the fees that we need to spend on the waste treatment. And this should be our first step to deal with these garbage treatment issues. We should not really let people to think they will see the effects 20 or 30 years later. We should really produce some immediate effect to our people. And talk about the containers will not use anymore. So who should be the person to deal with these containers? Some people think, like, as a president, you should deal with it. You should hands-on to solve these issues. But I believe we should rely on the key persons in different regions. We know it takes time, but this is something we need to think about. So you already mentioned the fees. We not only received the questions regarding the with treatment fees, we also received the question regarding the fees in different front.